This is Talking Foreign Policy, a critical look at Canada's role abroad, and I'm Yves Engler. Today we're going to be talking about Israel's war on Palestinian healthcare. The Israeli military recently attacked and emptied the Kamal Adwan hospital in northern Gaza, abused its staff, kidnapped its director, Hassam Abu Safi. A Human Rights Office report earlier this week said there have been 136 attacks on 27 hospitals and 12 other medical facilities between October 7th, 2023 and June 30, 2024. About 1,000 Palestinian health workers have been killed. Reportedly, the chance of being killed as a registered nurse or medical doctor in Gaza is 3.5 times higher than the general population. Yet, most of Canada's medical establishment has been complicit in Israel's attacks on Palestinian health system. The Canadian Medical Association has remained silent in the face of Israel's war on Palestinian healthcare, even though they, quote, unequivocally condemned the October 7, quote, terrorist attacks by Hamas. After Russia's invasion of Ukraine, the CMA divested from that country. To discuss CMA's complicity, we are lucky to have Yipeng Ge, who was suspended from his residency at the University of Ottawa for opposing genocide, who later resigned from the CMA board due to its complicity in Israel's genocide, and who launched a recent social media campaign for Israel to release the Kamal Adwan hospital director, which has more than around, I think, 5 million views on X and probably on other social media. So first of all, thanks a lot for coming on Talking Foreign Policy. Can you start off with just talking? I know you went to Gaza a few months back. Can you first of all just start by talking a bit about the scope of the destruction of the healthcare system in Gaza?
I mean, the systematic and deliberate attacks on the healthcare system in Gaza um, has completely and utterly destroyed any kind of semblance of a system that can provide healthcare reliably to a high or proper level standard of care. And it was late. It was sometime in October well, now it's 2 years ago, October 2023, when the Ministry of Health in Gaza reached out to the World Health Organization to send in emergency medical teams, which are external, international healthcare workers, to be on the ground to support the capacity of the local healthcare system that was already decimated at that point in October of 2023. And what we've seen over these 15 months is a sustained, systematic, and deliberate attack on the healthcare infrastructure and personnel in Gaza. Um, as you've already mentioned, over 1,000 healthcare workers have been killed. There are 450 healthcare workers who are abducted, detained. They are detained without charge, which essentially means they are hostages of the Israeli forces. These are Palestinian healthcare workers who have only been working in these hospitals and clinics, looking after their people, doing what they can with the limited resources that they have. Um, the healthcare workers in Palestine and Gaza have been extremely steadfast and resilient in returning to hospitals after they have been besieged. Almost all of the hospitals in the Gaza Strip, the 36 hospitals, were attacked and besieged at some point in these past 15 months. Some hospitals have been besieged and attacked and set on fire multiple times. And over the past week, we've seen the utter destruction of all of the hospitals in northern Gaza, the remaining ones that were partially functioning. Kamal Adwan Hospital, Indonesian Hospital, Beit Hanun Hospital, they are now all out of commission because of the attacks by the Israeli forces, the forced evacuations of all medical personnel, including patients, who are actively undergoing some kind of treatment, which means likely deaths by patients. And then also, we know that the Israeli forces, through multiple eyewitness testimony from healthcare workers, is that they single out the healthcare workers. They single out the nurses, the doctors for wearing scrubs, for wearing white coats, um, and they take them into questioning, some of whom, like Dr. Annan al-Bursh, was tortured, raped, and killed in Israeli detention. He was an orthopedic surgeon. There are countless stories like this where healthcare workers, because they stay um, in defiance of the Israeli orders to evacuate a hospital that is only there to treat patients and their people, because they stay back to look after their patients that do some patients, like patients who are neonates, for example, and the Kamal Adwan Hospital is a good example of this. It's the hospital that has the pediatric intensive care unit in the north. Some patients are neonates, and they cannot evacuate. They cannot move without the 24/7 care of a nurse, or of an incubator, or of oxygen, of medicines. And so for these healthcare workers to say, no, we are going to stay and look after these patients, look after our people, um, they practice this kind of liberatory, revolutionary medicine in the face of genocidal, colonial, Zionist violence. And to do that, I think it really enrages the Israeli forces that only know death and destruction, and through their uh, genocidal colonial violence, they see them as I think one of the biggest threats to colonizing Gaza, and so they take them into detention and or abduction, and as hostages. And this has been a systematic policy of the Israeli forces. If we even just look back to the previous escalations, the campaigns on the Gaza Strip, where the Israeli forces have attacked hospitals, have attacked healthcare workers, nurses, doctors. So this is also nothing new, but the ways in which it has accelerated over these past 15 months on the Gaza Strip is you know, exactly part of the genocidal campaign to accelerate death and decimation of all existing infrastructure to sustain any kind of life in Gaza. There are attacks, as we know, on other aspects of life, like food and water and shelter systems. But to attack healthcare systematically, we know this is the last line of any kind of support to keep people alive after they've been hit by gunshot fire, or injured in an airstrike, or bombing, or shelling incident. But it's also where people get their medications for their chronic conditions, whether it be diabetes, or high blood pressure, or high cholesterol, or having previously had a heart attack or stroke. This is where you get your treatment. And without these kinds of systems in place, you have excess death, you have excess mortality, and morbidity. So the impacts of disability, the impacts of disease that goes untreated and undiagnosed is extremely profound when you've also destroyed all those other aspects of life, food, water, shelter, and make it impossible to not to live, and to live with dignity. And and we know that the healthcare system, like hospitals and clinics, have also been where people, internally displaced people in Gaza, go to shelter, because there is, um, a semblance of, perhaps if you go to a hospital, this will be a place that will not be bombed, compared to somewhere else. This is simply not true. But because there is this idea that hospitals and clinics should be protected under international humanitarian law, which they are, many internally displaced people migrate, forcibly get displaced and move and migrate and shelter in these hospitals. Um, and and so they become like an entire community, an entire village of internally displaced people. And then for the Israeli forces to forcibly evacuate, shell and attack and strike these hospitals, um, and burn them and burn the equipment. There are uh, evidence of and case reports of like ultrasound machine wires being cut, imaging machines being destroyed, like an MRI machine being destroyed. There is no good reason to be doing this except to accelerate the genocide so that any possibility of resuming healthcare services to take care of a civilian, massively civilian population becomes near impossible. And yet, um, we have seen multiple instances where Palestinian healthcare workers do return to what remains of hospitals. For example, Al Shifa Hospital, which has like sustained like the building has sustained burning and to the point where I don't think many of us could have imagined operations could resume and for points in time, not anymore, but for points in time, there resumed certain kinds of clinical services like dialysis services. But this, I don't, we do this thing of putting Palestinian healthcare workers on a pedestal and heroizing them and glorifying them and there have been important critiques as to we shouldn't be doing this. We shouldn't have to be doing this for Dr. Hussam Abu Safia and the other doctors and nurses who have been abducted recently from Kamal Adwan Hospital in northern Gaza because they didn't choose to be heroes. They have chosen to look after their people as doctors, as nurses, as other healthcare professionals and workers, but they did not choose any of this. They are only doing what feels right to them in taking care of their patients as with the knowledge and the skills that they have, with the limited resources that they have. Um, and that alone is enough for them to be targets of Israel's genocidal campaign.
And I think for anyone who's bothered to look into the issue, it's just stunning. I mean, the scope of destruction is stunning, and there's tons of reports from different international humanitarian bodies, the UN, others that have documented the scope of destruction. And anyone who wants to just pay superficially attention to the news coming out of Gaza knows the scope of destruction. Now, the World Health Organization has put out many statements condemning what's taking place. But what's remarkable is the basic silence of most obviously the Canadian Medical Association, but in general, the Canadian medical establishment. And so this silence can't, in my opinion, be understood as anything but a form of complicity in what Israel's doing. Can you sort of talk a little bit about this silence from the CMA, and does the CMA have ties to Israel? Yeah.
Well, the CMA, or the Canadian Medical Association, is an organization that I know fairly well because through my medical school training and then later in my residency training, I was quite actively involved with the Canadian Medical Association. I led the national advocacy portfolio for the Canadian Federation of Medical Students between 2017 and 2019, and worked really closely with the um, political engagement or like government affairs portfolio of the Canadian Medical Association. So working with their national kind of like lobbying arm. And then later in 2023, I joined their board as the sole resident physician director of their board. And so I pushed internally for them to speak up about attacks on healthcare in Gaza. And the earliest attacks on hospital infrastructure and healthcare workers in Gaza was the Al Ahli hospital bombing in mid-October of last year, of 2023. I keep trying to say last year, but it's now 2025. Um, and um, what I got back from the senior leadership of the Canadian Medical Association was, yeah, we're preparing something, we're looking into it. And that was October of 2023, and no such statement was ever released to condemn like attacks on healthcare in Gaza. What and I know that this is possible because I know the track record of the Canadian Medical Association. As you've already mentioned, when Russia attacked Ukraine and also attacked hospitals in Ukraine, the Canadian Medical Association was really quick to condemn attacks on hospitals. Like that's this is like the like such an easy thing to say, right? Because these are our colleagues in healthcare that are being attacked. Their workplaces are being attacked. Um, and the Canadian Medical Association went as far as to also divest fully from the Russian Federation, and then also provide humanitarian aid to Ukraine, upwards of $250,000. And that is also just a drop in the bucket for the Canadian Medical Association because they sold MD Financial Management, which is like a wealth management corporation that they held, to Scotiabank. Back in 2018, if I remember correctly, for upwards of 2.5, 2.6 billion dollars. And so this is an organization that is a multi-billion organization um, that surely has investments in war and military industry technology, and has chosen not to be transparent and disclose those investments and to divest from Israeli apartheid, occupation, and genocide. Um, and should also surely have its charitable status be reviewed and likely removed, because this is an organization that says, therefore, representing the interests of Canadian physicians nationally, and has been entirely silent on attacks on healthcare workers. Uh, Specifically in Palestine and Gaza when we've seen them speak up in other situations. Um, and some of the interactions I've had with the senior leadership of the Canadian Medical Association um, is a reflection of what we see in a lot of institutions, whether it be through direct ties to Israel or sometimes just a discomfort with challenging um, the comfort of the oppressors, of Zionist colleagues and physicians, and their discomfort, their alligator tears take precedent over anything else, over putting out statements, over the material necessity that is the moral obligation and legal imperative to divest and to disclose. And they're not even doing any of that because they are afraid of offending and making uncomfortable Zionist voices on the board and on who hold significant influential positions, um, uh, informal and formal, um, and 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 we see this happen in many other institutions as well. And I think time and will tell with how these kinds of um, pieces of evidence will unravel themselves. Um, I'm not sure how exactly the Canadian Medical Association will do and stand with the test of time if they continue to remain silent at this juncture. Um, because I think more and more the evidence eventually will come out and show how they pander and to strong, seemingly strong and loud Zionist voices, which we know um, there is an absolute shift in public perception and the tide, where we know that I think Zionism will become more and more undeniably difficult to defend and to uphold. Um, and as the public perception and general kind of understanding of Zionism as a genocidal colonial ideology, this will eventually uh, dismantle the ideology, but also have supporters of it grow more and more silent, and eventually allow for humanity and life to prevail by appropriately through our legal and moral obligations to divest and isolate from Israel as it's committing genocide, apartheid, and occupation of the Palestinian people.
Yeah, Francesca Albanese, the special rapporteur for the occupied Palestinian territories, she's calling on medical associations around the world to divest from Israel in response to their destruction of the Palestinian healthcare workers and facility system. But you kind of touched on it, and there is this. It's kind of been remarkable to see amidst the horrors coming out of Gaza. There is this vocal anti-Palestinian, pro-genocide. I would even call it at this point a pro-Holocaust lobby within the healthcare system that supports what's going on. Back a year ago, 555 doctors at the University of Toronto signed what they called an open statement to the University of Toronto Faculty of Medicine from Jewish physician faculty, and they basically endorsed what Israel's doing, or they basically said, "Well, we don't want to feel uncomfortable about supporting what Israel did." And then about a month ago, the Jewish Medical Association of Ontario published what they called this study of anti-Semitism among doctors across the country, and that there was this big, fear, and they're basically trying to make the victims of the genocide in Gaza be Canadian, pro-Israel Canadian Jewish doctors. That's how they basically were trying to shift the discussion. And this Jewish Medical Association in Ontario, on their website, their statement of purpose states very clearly that their objective is to combat anti-Zionism and to build support for Israel. They state that very, very clearly. So, and I think probably a lot of people have seen some of these images, especially that came out of the encampment at the University of Toronto, where there was these doctors making threats to students that they wouldn't give them health services because they were opposing the genocide. So there is clearly this sort of vocal minority of doctors who are really supportive of what Israel's doing. And so my impression is that the CMA probably, a lot of people probably justify their silence by saying, well, there's sort of two sides and this kind of stuff. Though we know from your social media campaign around the director of the Kamal Adwan Hospital that there's clearly hundreds, thousands of Canadian doctors who are appalled by what's going on and would want to see more rigorous action from the CMA. So I guess kind of what's you referred to like sort of the crocodile tears of pro-Israel Zionist doctors in Canada, but kind of what's your reaction to this to these people within the health system? It's supposed to be about caring, supposed to be about this kind of stuff. Really, still 13 or 15 months into the horrors, absolute horrors, continuing to sort of basically justify what Israel is doing. And then can you also talk about I know what people should do because I know there's the demonstration coming tomorrow. Yeah, so a little bit more about the reaction of the pro-Israel forces within the health system, but then also what people should be doing.
I mean, I think I do want to mention that, like, the medical institution in the West, at least, has been um, one that has upheld a lot of atrocities and perpetuated a lot of atrocities. So it's not, once again, entirely surprising that they are such an oppressive, profession as a whole in this moment in time. Um, the if like a few examples we could look at is the Canadian physicians. They were the strongest lobby group against publicly funded healthcare in Canada when it was being pushed in Saskatchewan.
And they
They
actually went
went
on.
on
They went on
strike.
strike. Yeah, yeah,
They went
exactly.
on strike, right?
They propose
And they said
Medicare.
we're gonna withhold taking care of patients because we want to protect our our wallets. Because the fear was that publicly funded Medicare would affect their wallets, right? And it's just really interesting to see in this moment the Canadian Medical Association. They've like tweeted and posted how many times, countless times, on the capital gains tax changes, and so we see that it's they haven't changed in some of these really clear ways. Like, and medicine itself as an institution has also done horrible things to justify, like things like slavery, has forced sterilized many indigenous black people, um, and has even in this country, in so-called Canada, experimented on First Nations children, nutritional experiments, to see what would be the impacts on the body, the child body, if the body was starved of food. And these were things done in the not so distant past by physicians. And so when the ideologies of like racial superiority, like white supremacy and Zionism and colonialism, structural racism exist, and patriarchy exist so deeply within a profession that has co-opted um, healing into this, commodified thing that seems unattainable, that you have to go to a doctor to attain healthcare rather than giving the ability to take care, like for people to take care of one another, like back to the people. It's also not surprising in the ways in which the Western medical establishment is behaving, because of like institutional interests as well, right? Like these institutions have built themselves up in a way where um, we can talk about equity, diversity, inclusion, or whatever, in the ways in which they try to essentially groom people into positions of silence, of upholding these systems of oppression within these institutions. And I think in these really clear moments of clarity for what these institutions truly are in these deepest, darkest moments of overt genocide of the Palestinian people, I think we need to actually delegitimize these institutions, and isolate them and build other institutions that are truly life affirming and grounded in indigenous ways of knowing for the survival of humankind, of humanity, because these institutions are not going to do those things voluntarily. Perhaps they will change their ways with pressure as they have in the past, but I think this is obviously not sufficient, and ends to itself. I think I also wanted to mention that the ways in which Zionist physicians and the Zionist lobby frames the conflict, and this is also not a new point, many have also stated this, frames the conflict. It's not a conflict, it's a genocide, but the ways in which it like equates Judaism with Zionism in of itself is anti-Semitic by affiliating any Jewish colleague to like Israel or to the actions of Israel. That is anti-Semitism. And so some of the things that are really being pushed by Zionist physicians, or that letter that you mentioned, um, I think people are starting to really grasp, like people in the general sense of within the medical profession as a whole, or the general public, are really starting to see and hopefully starting to untangle what the differences between anti-Semitism and anti-Zionism are. And we have to understand that anti-Semitism as a form of discrimination within these broader other systems of oppression obviously has a place to be addressed, but has to be addressed in understanding the importance of like dismantling these forms of oppression in conjunction with anti-Semitism, because we are seeing rising levels of anti-Semitism with the far right political agenda, white supremacist political agenda, and the ways in which we have to be able to hold space for these different realities, and when we're seeing our Zionist colleagues, like, because and I think something that some folks do are really surprised to learn is that there are more Christian Zionists than Jewish Zionists in this world, and so when we have to be really clear about the language that we use in addressing and dismantling these things, but it is exactly Zionist colleagues, Zionist physicians that are using the language that paints Jewishness and Jewish colleagues with one complete brush, and that is anti-Semitic. And one really great rebuttal piece in the Grind was an article by some colleagues in Toronto refuting the findings, because it wasn't really a study that was transparent about the perspectives of Jewish physicians, that once again paints all Jewish physicians with one brush, without understanding the nuances of dissent, and a complete rejection of Zionism as a political ideology that has nothing to do with being Jewish, or existing as a Jewish person or Jewish physician. And I think, like, uh, the ways in which we move forward in this moment has to be intersectional in how we address all these forms of oppression that I mentioned before, and recognize that the things that we say around "we are not free until Palestine is free," or we say, collective liberation for all, you know, um, we really have to be able to demonstrate what this means in real time as well, and recognizing that what is happening in Gaza, in Palestine, surely does have an impact here, through anti-Palestinian racism that is being perpetuated by institutions, and the ways in which the Zionist lobby, the Zionist physician groups that push their agenda of equating anti-Zionism with anti-Semitism contributes to anti-Semitism. And so, of course, we obviously need to address that through, I think, sharper political education in order to separate out these understandings of what it means to be able to criticize and critique any political ideology and entity in this world. And Israel cannot be immune from that kind of criticism, and surely cannot continue to enjoy the amounts of impunity that it has for decades and generations.
And there's tomorrow, Monday, the 6th, there's a global call for a silent walk. Well, I don't know if it's a silent walk everywhere, but the one in Montreal, is a silent walk to call for Abu Sufia, the Kamal Adwan director's release, and to draw attention to the destruction of Palestinian healthcare system. There's also a email campaign started a couple of days ago by the Canadian Foreign Policy Institute, Just Peace Advocates, and others calling for to email the Canadian Medical Association to demand that they call they basically echo the World Health Organization. Just, I guess, on a little final note, there is this demonstration, Ottawa. I think it's happening at other cities across the country. I guess people, should be involved. I don't know if you're going to be there in Ottawa, but a little plug for that, maybe.
Yeah, no, absolutely. I will be at the protest in Ottawa. We have one on Monday at 5:30 at the Human Rights Memorial and or Human Rights Monument. And this is answering the call from Gaza and from Doctors Against Genocide to say we are, as healthcare workers, we are sick from witnessing this genocide. It is a normal, like, human reaction to feel unwell, to be sick, in witnessing a sick and deranged genocidal society destroy an entire population with and enjoying this level of impunity that it has for decades and generations, and for not seeing the tangible change that um, any meaningful tangible change on the ground. um, we have so much more that we can do, like, from where we are in sharpening our politics, but also sharpening our solidarity work. And what more can we risk for the people of Gaza? There is so much more, and so this is one thing that healthcare workers around the world will do tomorrow on Monday, January 6th, is saying we've had enough of bearing witness to genocide. We've done everything that we can. We've written so many letters and petitions. We've done so many press conferences. We've done so many different ways of pushing where we can. And this is another example of trying to do what we can from where we are and saying we are calling in sick from for this for being sick from genocide, and calling attention to the Israeli genocidal campaign in northern Gaza, but of course in the entire Gaza Strip, as it continues to destroy hospital after hospital, detain more and more, abduct more and more healthcare workers. Um, and also just know that the root causes of disease and suffering, which all of us healthcare workers are knowledgeable about and need to call attention to, and in the context of Palestine, is the occupation, the illegal occupation by the Israeli forces of the Palestinian territories. That is the root cause of disease and suffering that we're seeing. And so there are obviously multiple calls to action in pushing every institution to do what they can to divest from Israeli apartheid and genocide through the multiple Canadian companies that send arms and military components to things like the F-35 fighter jet planes that drop the 2,000-pound bombs on civilian life in Gaza. But also there are hospitals. In Ottawa, for example, the Ottawa Hospital is invested in multiple companies that normalize the Israeli occupation through partnerships, academic partnerships, scholarship partnerships. Like these things all need to be contended with and dismantled and destroyed and left behind, because like, Israel is irredeemable. Zionism is irredeemable. And the more that healthcare workers can do what they can in ending the ways in which, like, for example, there's also a group to divest their pension. Like there's like it's called the Hoop pension plan, and there's also a campaign at the Ottawa Hospital to force them to break those Israeli ties. And it only takes a few hard-headed people who are well organized, who care about humanity to do these things where they can. Like we all have such an important role in dismantling these forms of oppression from where we are, whether it be within certain institutions or outside of them. But we all, like especially living in the West, there are contradictions to our lives of how we benefit from the settler colonial state of Canada. And there's important pieces of work there to support Indigenous movements for land back and decolonizing so-called Canada. And so I think recognizing that important long stretch and long game of moving towards collective liberation, we need to be sharper in our politics and then move that to more beyond just bearing witness, but moving it towards solidarity and action that builds power with and among people, so that we can ultimately create the systems that are somewhat non-existent right now. Because many of the institutions, many of the medical schools, academic institutions are wholly complicit through their silence, but also through their material and financial support that they either haven't disclosed and are not nearly close to divesting. But we have small wins. They're happening in different places. And the more that we can, as the people of conscience, continue to push and organize ourselves and know that this is not ever like a one-day protest or one email campaign and we're done. This is lifelong work of pushing the needle towards collective liberation for all peoples, and especially and including Palestinians, because we learn a lot from the Palestinian people and their struggle against Zionist genocidal colonialism. And we learn from all peoples around the world as they oppose and struggle and fight against colonialism.
Thanks a lot for that. Thanks a lot for all your work over the past 15 plus months. And thanks a lot for coming on talking foreign policy. Yipeng Ge, who is a doctor in Ottawa. Yeah, thanks for coming on talking foreign policy.
Thanks for having me.